So tonight we're going to be having a conversation. The topic for tonight is how to increase and improve your caseload for your private practice or the corporation you wish to open. My name is Doyin. I'm a psychiatric practitioner. Welcome to Rethink Life with Doyin. This is brought to you by Rethink Life with Doyin and UBridge Health. I have a lot to share tonight, and I just wanted to, I'm ready. This is get your pens out, get your papers out. I remember like when I went in the PMHNP group, right? So just to give you guys a little background, I opened my practice immediately, right? Thankfully, as life would have it, the way it propelled me, what it was showing me, and I just, everything, and it was pushing me towards the direction of going to open my practice. If I did not do that, I would not be here right now having this conversation with you and empowering others to do the same, right? So it's a beautiful thing when you really, if you have a nudge in your spirit that is pushing you, it's shoving you, and it's saying, let me out, right? Or better yet, something in your life is showing you something that, hey, this is the next step for you. Please, I'm going to tell you, make sure you believe and trust on that. Because if you don't, you would end up thinking to yourself, why did I not do that? Right? So please make sure you have that nudge in your spirit. Go for it. I know it's going to be difficult. I know it's going to be scary, right? But you have to trust. Trust that life will always support you. Look at how far you've come, right? And where you are today. So always trust that life is going to support you. So we're going to talk about how can we increase our caseload, right, for our private practice or your corporation. The first thing I'm going to tell anyone, when it comes to your business, right? What I always tell everyone, your business is an extension of who you are, right? Who are you? Who are you? And we ask, I'm sure with our patients, we ask them the same question, right? Right. We always wonder, like, do they really know themselves, right? Same applies to us. We're psychiatrists, nurse practitioners, or psychiatrists, MD, or FNPs, or whatever that is that we do in our life, right? By the end of the day, just like our patients are going through things, so are we, right? And we also have to practice a lot of psychotherapy for ourselves. The psychotherapy, I believe, begins with the provider, and that way you can then impact other people's lives. So again, the first question I want to ask you is, what is your vision? What really propels your vision? You got to ask yourself that question. Most of the time, there's nothing against money, absolutely nothing against you wanting to make money. But the craziest thing is that when your vision is what propels you, right? Your vision, your mission, your purpose propels you, you're going to make money effortlessly. You know how sometimes people are like, it feels like you're chasing after money. Now, you don't want to chase after money. You want money to chase after you. You want money to come after you. Okay. Like literally when you have a clear vision and you know exactly what you want to do and how to attain it, trust me, it makes your life much more easier. I'm going to give you a little brief background, and I'm going to tell you guys something, right? The funniest thing is that sometimes for example, my company is called UBridge Health. When I knew that I didn't come up with the name. I could not even come up with the name of my business. Can you imagine? Talking about vision and clear vision. I could not come up with the name of my business. But I wrote down what I wanted my business to stand for. I wrote down what I envisioned my business to stand for. That is extremely important. Even if you can't come up with the name, just write down, maybe some things you don't want to ever see. Because you have to be careful, right? We are all business owners, or we're going to be one. You don't want a situation whereby the business you open now becomes everything you ran away from. That is very important. You don't want your business to be everything you ran away from. This is why I say that it's very important to know what kind of business you want to open. Why would you want to open a psychiatric business? And also, what is it that you want your business to stand for? Because if we're not careful as you proceed, you may become exactly what you ran away from. And you don't want. Because then everybody's, how we leave companies because we don't, people don't leave jobs because of, the job itself alone. Sometimes it's mostly management. So what kind of manager do you want to be in your practice? You are managing your business. You're not just managing patients, but you're managing the business as well. So this is very important. Vision, it starts with you. But if you can't even come up with exactly, start with, maybe if you can't come up with what your business wants to be, why don't you also start with, what do you want? Like, what kind of life do you want to live? We all know how we are, right? We were nurses, or we had, other degrees. I had a different degree before nursing, right? And we came into nursing for various reasons, but we were making some form of income. We all were making some form of income. But it's very important that we don't, and even though we were making that income, we were making that money, we still left that area. Because why did we all left for different reasons? We all left for different reasons. Some people, it's, for me, there was a point in my time in my life, I literally left a job that was giving, paying me. This was probably, this wasn't school, but I just felt like this, at the time, I just felt too bombarded at the time. I couldn't focus on everything I had to do as well when it comes to schooling. It was either schooling or the job. And I was like, yeah, I'm just gonna, and it was just, I was literally like less 3 months to be done with school. And I was just like, yeah, I'm gonna leave. And I did. I felt like a nudge in my heart. And I did. I started working. I didn't have, insurance. I didn't have all these things. And I just started hopping from hospitals to hospitals just to make a living. So, so making the money, yes, absolutely. But we want to, when we think about the business and how we want, it's very important, right? And I'm going to talk about delighting your patients. Okay. That is very important. The word delight, I'm going to talk about that a little bit more in detail very soon. But just remember the word delight, because I'm going to touch upon that. So now, how do we increase and improve our caseload? The reason I said it starts with the vision you have, right? What is it that you want for your business? It's a key. This is key to how you continue on, or how you build your practice, how you hire people. This is very important. Don't build your practice based on other people's vision. Don't do that. This is very important. I'm going to give you an example. I know I said on my last video, right? One of the streaming live streams that I did, I said that there's no need to share, right? I get it. All I would tell you is I'm working about 3 nurse practitioners' job. That's all I'm going to say. Right now, I'm training psych nurse practitioners to help them expand, build their business. And at the same time, they said, hey, Doyin, we like you, we want to work with you, and we want to be a part of your business, and we want to learn from you. That is what UBridge Health stands for. Aside from treating patients, I'm also, and there's a reason I'm saying all this, I'm also not just treating patients, but I'm also being the bridge to help other nurse practitioners, new grads, okay? Help new grads, in this case, be the bridge for new grads to be in the real world of being a nurse practitioner or a psychiatric nurse practitioner. Most companies do not want to hire a nurse practitioner or new grads. They don't want to hire new grads, and I know why. I'm not going to lie to you, it's very costly. Because it's very easy for me to hire someone that either has a business, for example, right? Because that means you're already credentialed with the insurance company. It's very easy for me to call the insurance company and say, hey, I just want to add, let's say I want to add Beatrice to the platform, versus having to credential them. I was speaking to a nurse practitioner today. She said when she joined the hospital, she had to wait 3 months. So most of the time, they don't want to invest that time into you. They don't want to invest that time into what you do or your practice. So if that's the case, right, it's all right. Don't wait. We don't have to wait for others, right, to show, if you feel like you have the leadership skill in you, if you believe that you have the mindset to put in the work, to learn, to study, to want to be better, trust me, everything we need to do when it comes to patient care, it's literally in the books. That's one. And also with listening to your patients, getting the right mentorships. That's very important. And I'm here today, this weekend, I've been working on creating little ways that can help us, especially the people that I mentor, right? Or that are going to be with me. I'm literally documenting medications and stuff like that, right? Ways that I do my practice. And I can also transfer that information. I will transfer that information to whoever wants to be a part of my practice or they want to open their business. This information, there's no need for us to gatekeep. So again, it starts with your vision. And I know I've said that so many times, but don't because someone says, oh, I make 50,000 and I make 100,000. For you, Your vision could just be, hey, I just want to make $20,000. Oh, I just want to make $10,000. Like, just stick to your vision. When it comes to the way you want to open your practice, don't do it because someone else opened a clinic. Now you want to go ahead and open a clinic. Don't do that. I want you to discover what it is that you want for your life and stick to that. Because if you are following someone else's shadow, eventually you will feel unhappy with your life. That's number one. And number two, for example, someone else could be telling you, I'm making $20,000. Whereas the vision that God has for you was to make $50 million. Be inspired with your story. Don't start comparing yourself like, oh, they're making, $5,000 or they're making $500,000. I'm only making $20,000. Oh my God, I must be a failure or I'm not doing great. No. Use that as an inspiration. Absolutely. I'm all for that. But I'm just saying to you, it does not matter because your vision is your vision and stick to that. You're going to need this through this journey. Okay. Now, where do we get patients? This all starts with where your vision. That's the reason why I mentioned this. Where do you get patients? I'm going to tell you guys some things, and I've said it a few times. I made a video that was talking about psychiatrists near me and therapists near me on my channel, on my platform, Rethink Life with Doyin. And that video, and I'm going to go in depth. I actually watched that video again today to prepare myself for you guys so I can give you the right information. Okay. So that video, it talks about, where can you find psychiatrists or therapists near you? But also as nurse practitioners, right, we have to think like the patient. Let's talk about the patients. If you don't even know, let's say I've been talking about niche, purpose, and I know how to help you discover that for your practice and also for yourself. And also when it comes to career path, what kind of job or career path you want to go into. I know how to do that and I help people in my practice. But assuming you don't know, right? We haven't delved that deep. Assuming you don't know, what I want you to do is I want you, right? Just think about the lifestyle you want to live for yourself. And then let that help you with the way you plan things. Most of the time, right, we have something we call direct credentialing, and we have also indirect credentialing. Again, there's direct credentialing and there's indirect credentialing. When I say indirect credentialing, I'm referring to, like Headway, Grow Therapy, right? Alma. Those that I actually came up with that term, indirect credentialing. So, okay. All right. So indirect credentialing, right? Any third party. The reason why I say this can hurt or harm your business through my journey, and this is something I'm very transparent with you guys. For example, I went ahead, right? And when I opened my practice, I went ahead and I went to search up myself. I wanted to see how I show up on these platforms. And when I found out, right, some of the platforms that we use right now, and don't get it wrong, they're very good. They're helpful. But you have to, depending on what vision you want to create for yourself, you may have to, along the way, change things around. I'm going to tell you what I mean by that. I went on the platform, for example, Headway, right? And I was like, oh, let me see how I've been credentialed. Yay. Let me see how I show up. And I went on the Headway. And what I found was, number one, right, the numbers. I was credentialed. Yes. This is the reason why we're not getting patients. I called the number on, right, that was listed for Headway. I called the number. Boop, 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 boop. No dial tone. I'm like, oh, dang. This is what my patients are feeling, right? If nobody's picking up the phone call, do you see what the problem is? And that's why I say I can help. Probably if Headway can fix that area, we can have a conversation. But I'm just trying to let you know, as a result, some people get patients, some people don't. Headway is it's great. Don't get it wrong. I really love them and I still use them today. But what I had to do, how do you fix that problem? When you get credentialed, please go ahead and call the company. And this is probably where Headway is probably going to take you off their platform. In some cases, they will. Okay. But in some cases, they won't. It all depends. Okay. But what I want you to understand is you go ahead and call the insurance and say, hey, okay, so Headway is number one, but you know what? This address is going to be number one. So that way, when patients call you, guess what? They get to connect with you. Does that make sense? So that's very important. So Headway, Grow Therapy, all of these companies, they're indirect credentialing. And understand, if anything happens to these companies, not saying nothing or anything will, but if assuming you decide to leave, Alma, for example, or you decide to leave Headway, for example, depending on your vision, if you just want to do it on the side, that's great. Use them. But for me, I have a corporation mindset because of the lifestyle that I want to live. I don't mind teaching. I enjoy pouring into others, teaching them what has helped me and how to help them be better and bring out the leadership skill in them. And I want them to live the dream life they want. So this is what I'm saying to you guys, okay? That it's very, very important you stick to your vision. This is what drives me. And I want this is what should drive each and every one of us. It's not about somebody has a clinic, I have an IOP center, I want to be like that. No, what life do you want to live? Because you can make all that money and it comes to a point you don't even care about the money. You just want to live life. You will make the money. You will. Trust me, you will. But I will help you discover your purpose. And I will do a live stream one day because I'm supposed to do it. I just wanted to let you guys be aware of what I'm doing right now. So again, if you're doing indirect credentialing, again, if this is it's helpful in the beginning. But if you're thinking corporation mindset, if you discover later on, hey, I think I want to, based on what lifestyle that I want to live, I think it's better for me I want to know where my money is coming in. I want my money to come into my pocket, right? I want to negotiate with these insurance companies. There's not all great. Don't get it wrong, to be directly credentialed. It's not all great to be directly credentialed with insurance company either. And I will talk about that. But if you know this is what you really want overall, right? Because those indirect credentialing companies, they also taking some of your money a little bit. And they are also helping us. But if you know what the life that I want to, hire more people. I want to do this. I want to do that. I want this longevity. I want to build generational wealth. This is the, I want to make a big change in the world as a psych nurse practitioner. I feel it within my bone. I know myself. I'm always someone that thinks I always want to evolve. If that is who you are, you're not going to be okay with just a side hustle. Trust me, especially if psychiatry is your niche. So this is very, very important. Okay. So again, Alma, Headway, right? Grow Therapy. Those are all indirect credentialing platforms. So another place you can also, I just heard from someone, is called Quartet. I haven't tried it yet, but I might be wrong. Maybe I'm saying it wrong. But Quartet is another website. Another website you can use that you can put your platform. You can put yourself on this platform. So again, Alma, Headway, Grow Therapy, indirect credentialing. But don't forget, eventually you're gonna have to switch things around. When you get directly credentialed, call these companies up and switch things around. Because if you don't, imagine if you're credentialed, you're hurting yourself because you have those companies there. You can still use those third parties company while you also are directly credentialed. So just remember that. Okay, if they allow you. Some Headway might not. I don't know. But I'm just letting you know you should be able to. I'm still there. It's not a problem. Okay. Now, so don't follow other people's vision, right? You will make money. Just remember that. If you don't know, just let the life you want to live. Let that be what propels you and helps you steer your business the way you want it. Of course, we all know about ZocDoc. I educate all my patients, and I want you guys to also educate your patients. Okay, tell them about the $70, or better yet, they can be banned. So, Halma, Headway, ZocDoc, Grow Therapy, all of this, or I'm gonna actually tell you all of them, and then I'm gonna tell you some things about them and when you should use them, because it's not all of them you're gonna be using. You have to know how to strategize. Very important. Strategize. So, for example, you just started a business. You don't want to pour in too much money. Your overhead cost, you don't want it to be so high. While you have the indirect credentialing, right, you can also get your direct credentialing going, right? You get register your business, you get your EIN, all that beautiful stuff, right? We're trying to navigate the waters right now. I don't know everything, but the little that I know, or the much that I know, I'm sharing with you guys. Okay, so again, Alma, Headway, Grow Therapy, ZocDoc, Psychology Today, Yelp, Yahoo, Google, okay, and insurance websites. That I'm gonna say that right now, and I'm gonna go into. You can probably get your pen if you like to, but Alma, like I told you, right? They help you get credentialed. Normally, they do pay a little bit more, which is great. They pay you a little bit more, which is great. But remember, you are not directly credentialed. It's an indirect credentialing at this time. Headway, same idea. Okay, growth therapy, same idea. Psychology today. I'm gonna stress this. Your profiles, it's very important that your profiles, I want you, I tell you, this is gonna make one of my mentees, right? It's gonna make her laugh. I tell her, too much grammar, too much grammar. Don't, and I did this. I'm like, no, don't use too much big words. Don't. Our patients, they don't really use AI to write your profiles if you have to. Write it on a fifth grader level, third grader level if you have to. I tell her, no, too much words. No need to, I know people are saying, oh, my name is this and my name is that, and this is who I am, and I'm a licensed. They already know who you are. What and then this is why when you discover your niche, right, you'll be able to tailor things. For example, my own thing is my area, my purpose. When I say niche and business has to do with your purpose. I know they say niche, but it's literally your purpose. But now your niche is going to be your natural gift to be able to tackle the problem that you want to solve in the world. So again, your niche, right, is your natural gifts that will allow you to thrive, to be able to tackle the problem in the world. That is how you fix the purpose. And trust me, you will make money. My own thing that I do is I help you, it doesn't matter who you are. You want to, find what career path you want to be in. You want to open your business. You need to know your vision and mission. You need to get the business plan going. You want to be clear on what your vision is. That's what I can help anybody with that. You want to, what career path should I go? How should that's my gifting. I'm gifted in this area. And I help my patients, right? If you want to, they want to change a career path, what should I really go into? How would I thrive? If you want to come back to me and say, what can I make money out of this and stuff like that, or make a business? That's what I'm gifted at. And those are the people that I gear towards. And like I mentioned in one of the videos that I made, I said, normally, sometimes this has to do with it. This occurred to me, right? There was a point in my life I thought, I was supposed to be something, but I wasn't. I became something else. Instead, through the journey, I was a nurse, but I eventually discovered medical school was not what I wanted to do. I would have thrived in that. Don't get it wrong, right? And I'm not trying to brag or anything. I know myself. But which one is going to make me live the life that I truly want and I love, and I'll be able to do what I'm doing right now? That doesn't feel like work to me. This is it. It's not just only psychiatry, but it's building leaders and changing people's mindset. That's what I know that I enjoy and I love. And this is crazy, but this is what my friends, what do people come to you for? What do your friends come to you for? Okay. So I knew that my friend, I asked myself, what is something I would do? And I don't care if you slap me in the middle of the night and say, get up, let's go do this, and I'm not paying you a dime. And I knew that it was talking to people and making them feel good and changing their mindset. So that was the reason I went for what I went for, and I decided to let everything be. So most of your friends, they're coming to you for a certain thing. It tells you, gives you that little nudge to know exactly what it is that you're good at. And those are the questions that I ask as I proceed, or whenever anybody wants to open their practice or discover who they are or what kind of life path they want to go. Okay. So Alma, Headway, Growth Therapy, ZocDoc, Psychology today, please, again, like I said, your profile. Keep it simple, sweet and straight to the point. Third grader level, what is it that you can help someone with? That is why you have to discover what it is, because you don't want, for example, if someone is about women's right, you want those kind of people to come to you. If someone else is about, helping people feel good about themselves, not just physically, then that's what you are. If someone else is breaking down stigma, that's what you're going to talk about. If it's someone like me, if it has to do with, helping you discover, change your mindset to become the success you want to be in life, and then, thrive in your area for life, then you write about that. You're going to get the right clients. And this is how you're going to work effortlessly with my own vision, right? And knowing my purpose. Now I know I can go to high schools. I can go to colleges and literally speak on this and how to help them. Can you see where there'll be I will always get patients. Do you see that? Then that's my plan eventually. That's why I'm working strongly right now, so I can then live the life that I really want to live. This is why it's very good to know to have a clear vision of exactly what you want to do. And like I said, if you have any question, you need help with that, I will help you. And again, I will be doing live stream about that. Now, Yelp. Yelp, I know, Yelp. So Yelp is great. Absolutely, you can put yourself there. They do have a free listing, right? But again, everything strategize. Think about the money you have to spend. The business will tell you when to spend it. The business will tell you when to put it. When you start making money, like before, I was like, I don't know, we have to pay how much? 120 or whatever that is. I'm like, that's too much. I couldn't do it in the beginning. I canceled. Now I can. I joined it, but I canceled because I'm like, compared to how much I'm making and how much patients are coming in, this math is not mathing. It's not working out. So guess what? What I did was I canceled. Now I can go back to Alma. Absolutely. Okay. So you want to strategize well. Yahoo is another one. Google, right? Again, when it got to a point in my business, I was able to use Google. But one thing I found about Google, and this is something I'm going to tell you, I have a lot more information. Trust me. This is just, I'm not even halfway there. I have a lot of information that I want to share with you guys to help you. But Google, right? Google, I and there's a guy on my group, right? Is gonna talk. I'm gonna invite him to have a conversation. But what I will suggest to you is that if you don't have you don't have, because Google can be a little tiny expensive. Okay, it can be a little expensive depending on how much on how many patients you want to come in. But if you don't have a Google presence, right? Number one, Google does not support. It does keyword. This is why it's very important when I say location and your EHR, very important. Google does not support, just letting you know, it does not support virtual offices. It does not. So if you know you have a virtual office, please, 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 please go get a physical, like a real life office, like a real office. Rent it, and because they're gonna ask you for a video. Okay, when I first did mine, I did have a physical office. Actually, I had a physical location, but not a physical business live location. So I was sending Google my apartment, like I'm seeing patients, and they were like, no. I did it like, that was one of the hardest part of my business. I think I did it more than 30 times. I was sending them videos, and eventually Google, I even wrote, this is how frustrated I was. I even wrote the founder or the owner of Google. I Googled his name. I tried to find his email. I don't even know if it's accurate, but that's how frustrated I was. I did not know that information. And this is why, right, mentorship is very important, because I know this information. I'm sharing this information with you now. And this is what I do. I help everybody that I'm mentoring, and I help them systematically to become the success that they really truly are. So it's very important that you stick to your vision, and of course get some guidance if you don't know some things. Some people that open corporations, or they have or they have a lot of patients right now, you don't know what they have. Like, you don't know who they're connected to. You're right. There's some people are getting patients from the hospital, right? I'm a new grad. I don't have any connection with the hospital. Okay. So you want these things are very important. I just need you to, be mindful of that, right? You're getting your patients organically. So we can't, right? Some doctors, I'm not gonna say, some people can be, not some doctors, some nurse practitioners can go ahead and do whatever they want with patients. But if you're getting your patients organically, you may not have that. You may not have that liberty to be doing that. So you want to be very careful when I say delight your patients. And I'll explain to you how to delight your patients. Okay? Very soon. Now, other things you can do, other places you can join, which I also posted on my video that I did, right? The psychiatrist near me and the therapist near me video. And I'm going to go back again. Join Uplift is called, keyword, it's join. That's the name of it. It's called joinuplift.com. So you can join that as well. It's almost like Headway. Quartet is another one. Put yourself on that, QUARTET. Log in and join that as well. Therapy Den, again, keep your profiles nice and simple. Therapy Den, you can go on there, look from, call some therapists near you, Google some therapists near you, right? They're going to tell you no, and that's okay. No is okay too. I was told no by a provider near me. They told me no, and that's all right. It was hurtful. It was painful. I felt sad. I'm like, I'm trying to change the world here. I'm trying to help somebody here. And I felt like, there's no competition. It's so sad. And so I just wanted to remind you, will get no's, but the no's, through your nose, it would lead you to your yes. Through your nose, it will lead you to your yes. Don't give up. Okay. So again, make your flyer. I emailed hospitals. I sent letters out. I don't, not, I call, my assistants. I'm like, hey, the people that work with you, utilize them to your advantage. I'm like, hey, listen, what do you think about what I just wrote? Do you think this is a nice intro to send to the hospital? And he was like, yo, yes, I think this is good. Or he modified it, gave me his own ideas. That's like the people you want to work with. Utilize them. These are people that are going to help you build your business. You're not alone. Don't do everything by yourself. It's a lot of work. Go to salon where you get your hair done. Tell them about yourself. Go to law offices. Go there. Bring your card. They have clients. Go there. Okay? Go there. Okay. Pharmacist. Go there. Pharmacists will help you too. Bring your card. Let them know you're here. Another place is called mywellbeing.com. Like I said, watch the video. I posted everything there. Optum Express list. Join the Express list. Because like I said, you may be credentialed. This is for direct credentialing people. But you will not be found under psychiatrist. Because over there, as far as I know, I went to a lot of websites. Most of them, when you type in psychiatrist, you may not be found. They have patients. Educate your patients about psych nurse practitioners. What I'm doing on here is to shed more light on PMHNP and what we're all about. By we doing this kind of stuff, we would be able to get more people aware of psych nurse practitioners. This is why I do social media as well. It also helps my business. Don't get it wrong. But I'm just letting you know. This is also going to shed more light, especially when you're covering your niche and everything like that. You understand that? So again, my well-being, Thriving Campus. That's another good one. Thriving Campus is good for people that want to channel or get to have conversations with, let's say, Thriving Campus is good for college students. Okay. You may want to charge not as much. Okay. But again, Thriving Campus, that's another good one. Okay. So join that. Thriving Campus, health grades, join that as well. Like I said, watch my video on psychiatrist near me or a therapist near me on Rethink Life with Doyin. Insurance platforms, I already told you about that. Join the Express list. Not all of them have it, but like I said, I think United Healthcare, they have it. So join that. When you are keyword credentialed, don't forget that. Let me see. There's another one. Okay, so law offices, libraries. Another beautiful thing that I heard from another provider, right? Libraries. You want to join libraries as well. Go to libraries. As far as I was told that they have 5, right? 5. You can host 5. Actually, I heard about libraries from someone else as well. Go to libraries, and I also heard that from Dr. Logan. But go to libraries, and I also heard that from another therapist that I also work with. You can host events there, right? Go to restaurants. Bring, like Dr. Logan was also mentioning, bring apples, right? And bring, and water bottles or whatever that is. Go to gyms. I've seen another providers. I've seen her, a flyer. I saw her flyer at one of the clothing store that I go shop. And she said her sister put it there. Go to those places and just ask, can I put my card here? Go to ShopRite. Host an event there. Go to your library near you. Host an event there. Go to the gym. Put your cards there. Right? Let them know you're here. Go nearby you. Again, law offices is another place. Law offices is another place that I mentioned. Call therapists near you. I had a therapist. She even brought people that I know, right? And she was like, I don't send anybody to, virtual offices. I need to see what you're all about, who you are, how do you treat your patient. And now she bombards me. Okay. So join those programs, join the empowerment programs. If you want, for example, go on Facebook, join those groups. They have some bipolar depression groups. They have for men, join Black NJ or Black whatever company on Facebook. Join them and let people know you're here. Put yourself out there. Create a lovely profile. Whenever you go to see providers or whenever you go to offices, dress good, look good. You're going to get patients. You also don't want to get patients all at once and be bombarded. You don't want that. You don't want that because you're going to thank your lucky stars as patients come in systematically. Be thankful because especially for me as a new grad, it was a beautiful thing. Another place, when you get no, like I told you, the no's will lead you to your yes, okay? Host events, colleges, libraries, right? Go there. Go to high schools if that's what your niche is. If you love working with children, go to elementary schools. Go to the nurses. They'll refer patients to you. Trust me, they will. Okay? Go to the PTA at the schools. Go there and then bring your card. Go there. Trust me. I went to another, it was a financial group. I went to one. Go there. It was a financial group for college students. Go there. Give them your card. Introduce yourself. Let them know what you're all about. You're going to have to get out there. You don't have to be talking every second, but just whenever you go to, like, your reps, connect with reps. Find out a provider that has a rep, right? They know the providers that are closing. They know. They do. So they will send you. I had a few that sent me patients. They did. Go there. They will help you. They were like, oh, Doyin, I wanted to recommend you to this, doctor because she's closing her office. Would you like to take on the cases? Do it. So treat your reps nicely. They will take care of you too, and they will help you out. Okay? They look out for you. There was a rep that was even asking me, oh, so your office, tell me, how much do you pay here for the office that you have? I do both virtual and I do office. So 4 days and then 1 day in the office. And she was like, how much do you, blah, blah, blah. And I explained, I told the person how much I rent. And they were looking for a provider. That was a rep. 2 of them, they were doing that. See, again, go to restaurants, gyms, put your cards, flyers, go to ShopRite, food stores, right? Use the mailing system, right? I would suggest to you, they have some companies that literally they would like send a lot of mails out, right? When I went to the financial company, financial events for college students, I asked the guy, I said, oh, so how are you guys able to send the flyers? It was like, oh, we use a mailing system. I'm like, oh, okay. So in my head, I'm like, when I'm ready to do that, because I'm good right now, I'm not gonna lie. And then I said, I need help. Okay. So I'm hiring some nurse practitioners and I'm training them right now. But literally, right? And also refer to you. I have providers that refer to me and I refer to them. Network, work together. This is a collaborative effort. If you know you have too much, send it to somebody else. And I do that. And they do that for me too. And I'm thankful to them. And they're also thankful for me. So again, go to high school, elementary, adults, look good, know your niche. Bring your other colleagues along, reps, hospitals, right? IOPs, go there. Network, call them. You may not be able to go everywhere. Call them. Go to therapist office. When they ever send your patient, go back and thank them. Bring some food, right? Do something nice for them. Bring them dinner, bring them breakfast or whatever. Just say thank you. Or even maybe the first time you go there, bring something and say thank you. I just wanted to, introduce myself. I had a therapist. They even, they called the state to make sure that I was truly a psychiatrist, nurse practitioner, right? So these are all very important. If you have one state, like I said, you may want to join, get another 3 states, get 2 at least. Don't do too much. You're going to get more. But if you have a restrictive state, please get another state. So when I talk about delighting your patients, right? Very important. Now, I want to talk to you guys about how you keep the patients. This is very important because yes, you want to get patients, but now how do you keep patients? Let me tell you something. When you first begin, you may not, all the patients you first see, there will be some patients that would not stay. That's all right. That's just the reality. Not everybody's going to love you, but you want to delight them. You want to leave them with, with something pleasant. There are many ways we can delight our patients, including making a patient feel welcome, right? How do you pick up the call, right? How do you talk to your patients? Very important, right? A warm welcome. I have patients that I'm not helping. I tell my assistant, we're not able to help them, right? Because we don't provide the service. But that's all right. Make your patients feel welcome. A warm welcome and comfortable waiting room can help create a memory experience if you have a waiting room, okay? Communicating clearly, right? Tell them what's happening. One thing, there's some providers that would not tell their patients their diagnosis. I do. And it's so crazy. Patients appreciate that. Now, there are some cases they may not appreciate it, but there's a way you can talk to them. It's the chemical imbalances. For example, if someone has bipolar depression, right, they might not be happy with that diagnosis. Some people, I have had a patient that was like, thank you so much. I'm so grateful that you took the time to assess me. She was like, the person was like, man, Like there was so like I knew there was more to me than this. And they were so thankful. Isn't that crazy? So if given if someone the right diagnosis, they were thankful, even though the diagnosis was a little more extra. Some people may not be happy with the diagnosis. So sometimes if it's a child, right? I may not want to say you have, even though I notice maybe I think you may have, and I learned this from one of the my preceptor, right? And I asked her, she was like, "Hey, yeah, you might not want to tell a child, that they have bipolar, right? Even though you see it and you think, not children, of course, not children, but just saying, just using the word literally, right? But let's say adolescents or teenagers or 18-year-old. In those situations, like, you know what, you want to observe a little bit more. So in that case, I will put unspecified mood disorder, for example, right? I will put that there, or mood disorder unspecified or something like that. And I would just, I can tell the patient and say, you know what, I want you to pay attention to these triggers and blah, blah, blah. So you understand what I'm saying? Okay. So another thing that I do that I did in the beginning when I first began, I had the time. Now I can't keep it. Okay. And that's something you don't want to do, right? But I do it, but just differently now. But when I first began, I used AI to write a letter to my patients and I signed it and I sent it to the patient. Delight your patients. It's not just about being nice, delight. Do something that leaves a lasting remark in a positive way, in a positive light for your patients. You don't have to do it that way that I did it, right? Like I said, I had the time and I wanted my practice to be a certain way. Now we don't, I can still have, I have two assistants. I can have the other assistant do that, but we don't do all that. I just go ahead and still write a letter and we just, go ahead and send it to the patient. I had someone that was like, I thank you for doing that. You didn't have to do that, but I thank you for doing that. And they made, they gave us a rating about that and they mentioned so. So this is very important. So now let's fast forward, right? Keeping your patients informed, right? Acknowledging there's, birthdays, special birthdays, all that stuff. If you have the platform that does that, my platform unfortunately doesn't do all that. But whenever I recognize that it does that, the patient's birthday, I go ahead and so I've sang to my patients before with my lovely voice. Yeah, I'm kidding. But literally, I did, right? Excuse me. So you can go ahead and do that, right? Keeping your wait time short, right? So I tell my patients within 5 minutes, I'll join you shortly, right? And and within 5 minutes, I try. They understand, and because when I get it, we are trying to do fast food situation here, but it's not always fast like that. I want to take time for each patient. I've had patients in my the people that I work with me, they've seen me literally. I'll tell the patient, I used to do 2 hours when I first began. Right now, I can do things in 1 hour, and I can even do my follow-ups in less. There's a way that I do it. I do, and I'll, if you want more information, contact me directly, or I'll call you, or whatever. But there's a way that I do things, or the way I do things in my practice. Right? Initially, it was 2 hours, and I still, now I can do it within 1 hour. But if I have a new person coming on board, I'm not gonna do 1 hour with you. No way. You just started. You need to be there for 2 hours. I used to do my follow-up for 1 hour because I was doing therapy and all that stuff together. And as time goes, as the patient progresses, then I can reduce the time a little bit. But I always want to make sure before a patient leaves, I say, do you have any other questions? You want the patient to talk. I have patients that like to talk. And I will go ahead and, I will give you the time. I'll say, I'll call you back. Okay. Treating patients with respect. That is big for me. Huge for me. You have to understand the way we're prescribing, right? Also is one of the ways we also make money. So I'm not saying don't give patients 30 days medication. Do that. If but I will tell you, do that when keyword, that the patient is stable. You got to get that conviction within yourself. So don't go ahead and prescribe medications for 30 days for a patient if you know they're not stable. You are a new grad or you are a provider, right? This is your business. So there is an art to how you prescribe. Very important. Okay. So how do you prescribe? Number one thing I do, one medication at a time. One medication at a time. Discover the root cause and tackle one medication at a time. Very important. Okay. Number two, you don't want to go ahead and prescribe. Like I've had patients, if you're nervous, I'm going to follow up with you in 1 week and I'll give you the medication for 2 weeks. In some cases, I give medication for 1 week, depending if it's like stimulants or whatever. Okay. But if it's like, but if it's a student, if I don't give Adderall, for me, I do non-stimulant first, except you're in school and you need me to like I see like your life and everything is like all over the place. Okay. Then we need to, I want to take care of things a little faster for you. Right. So those, again, use your discretion. Okay, do your EKG, and I educate my patients. I talk to them. I let them know the medication. I let them know how it's working. I let them know the treatment plan. I give them a summary. I let them know exactly everything. They're involved. They know what's going on, and they know. Okay, the weekends I'm open. Message me before 1 o'clock if you have to, emergency wise. But if it's not something, I check my phone. But they understand. I'm not working here 24/7, but I will try to reply to you as soon as I can. But I'm closed on weekends, technically. Right? I just do that because this is my practice. This is my baby. I want to, again, one medication at a time. I've had cases that I've had to give stimulants to people that also have, that were on Suboxone and all that stuff. There is like and I did talk to my preceptors and my mentors. I did talk to them about that. And they said, yes, you can still do that, but use your discretion. All of this is very important. I shared all the information that I know and what I know on when it comes to how do you increase and improve your caseload for your practice or your corporation that you want to open. If you may not see the vision right now, but I'm working at it, right? And same thing for you. Keep working at it. Think of the life you want to live and make your business be about that. Don't compare yourself. Someone is making 50,000. You don't know what they do in their practice. You don't know how they treat their patients. There's an art to how you prescribe medications. There is an art. And that's going to also help you put money into your pocket. So sometimes I will have a lot of patients scheduled in my practice, right? I will have them scheduled in my practice. So maybe this week, the next week I'll see you. Same idea. Get the parents involved, get the patients involved. I have parents that now they're living with their children. Some children, I'm playing games with them and we're playing how to, put Barbies together. Like literally. I have some children that I take children. I was gonna be like other providers. I'm like, oh, I don't do children. I was gonna be that way. But I was like, no, Doyin, children love me. I love them. So no, I'm not going to be like someone else and do the same like someone else. I'm going to do it the way I know how. And I accept children. Thank you so much for everyone. Again, don't forget to subscribe on Rethink Live. My name is Doyin, founder of UBridge Health and also Rethink Live with Doyin. So happy to have you here. And thank you so much. Really, really appreciate your presence. Thank you. Have a wonderful night. Enjoy. Bye-bye. Don't forget, please be sure to like, share, and subscribe. Thank you.